The first case I used, the HA plus wrap, was on a traumatic open fracture to the forearm in a young individual who had a very severely contused median nerve that was intact. I knew that there was going to be a large amount of fibrosis. That patient's nerve had already been through quite a bit with that amount of injury, and it was easy to use. It gave me a large length to protect that median nerve, the entire area that I could tell it was contused, and in my mind, to give the best potential recovery of that nerve. The median nerve is about 6 months out now and has had full recovery of the nerve with motor and sensory function. And even before this 6-month point, the nerve had recovered well. The patient also has healed his fracture and has had full tendon recovery. And we have not appreciated any adhesions within the tendons or the muscles of the forearm to the nerve. There's no pain on full range of motion or stretching of the nerve. We tried to stretch it on full extension, flexion, and no irritation with that.